5 common medications that can damage your kidneys. We live in an age of medication. They aid us in various ways, but they can also kill us quietly. As we get older, our kidneys become less efficient. It's critical to keep children away from excessive chemicals and medications. However, it is difficult because aging frequently results in a slew of health problems and extra drugs to consume. Certain drugs are nephrotoxic, which means they can injure the kidneys either directly or indirectly. As a result, the kidney's ability to filter blood decreases, and toxic waste accumulates, posing major health risks. Kidney damage severity is graded in stages, from mild malfunction to full failure. As you get older and have renal problems, your risk of drug-induced nephrotoxicity rises. Medication-induced kidney damage falls into 2 categories: dose-dependent toxicity and idiosyncratic toxicity. Dose-dependent toxicity indicates that damage rises with increasing dosages. In contrast, idiosyncratic toxicity is unpredictable and varies considerably among individuals. It is sometimes preferable to avoid these medications entirely. Drug-induced nephrotoxicity can be caused by muscle tissue breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid accumulation, renal tubular acidosis. This can lead to impaired kidney function and other disorders such as nephrotic syndrome or electrolyte imbalance. In this video, we'll look at the effects of common medications on kidney health and offer practical advice for appropriately managing these prescriptions. Remember that recognizing the associated risks might help you make more educated healthcare decisions. Stay tuned to discover how to protect your kidneys while efficiently addressing other medical ailments. Before we begin, please keep in mind that all of the information in this video was created and is intended for humans. We do not automatically generate text using artificial intelligence writing tools such as ChatGPT. Be certain that our content has been properly fact-checked, unbiased, and verified by qualified people. Okay, it's time to get back to the medications that can affect your kidneys. 1. Lithium. Lithium is a prescription medicine used to regulate mood and treat some mental diseases. These mental issues include mania, which is characterized by intense excitement, overactivity, or distraction, and bipolar illness, which produces mood swings between extreme highs, mania, and lows, depression. Lithium brand names include Priadel, Camcolit, Lisconam, and Lee Liquid. For almost 60 years, these medications have improved the lives of many people suffering from bipolar disorders. While lithium might be a lifeline for mood stabilization, its effects on the kidneys should not be overlooked. Long-term lithium consumption can cause major kidney problems, such as acute and chronic kidney disease and kidney cysts. Lithium-induced kidney damage may be reversible at first, but it can become irreversible with time. The primary concern with lithium use is nephrogenic diabetes insipidus, a kind of diabetes associated with kidney impairment. This is not your conventional diabetes, which is characterized by high blood sugar. In this illness, your kidneys are unable to adequately respond to antidiuretic hormone, ADH, a hormone that regulates fluid balance. What was the result? One may experience extreme thirst and frequent trips to the restroom. In rare situations, long-term lithium consumption might result in end-stage renal disease, ESRD. Lithium-induced kidney problems include increased urine output and thirst, frequent midnight urination, and indications of dehydration such as low blood pressure and a fast heartbeat. In severe circumstances, it can alter mental status. Furthermore, lithium might cause the kidneys to excrete too much sodium, which is known as hyponatremia. Sudden hyponatremia, a condition in which sodium levels drop rapidly in less than 48 hours, can result in major complications such as life-threatening muscle breakdown, rhabdomyolysis, severe disorientation, seizures, coma, and even death. Patients should eat a typical diet rich in salt and water when taking lithium. Furthermore, when using lithium, it's critical to establish a correct dosage, obtain yearly blood tests to evaluate creatinine levels, and seek medical attention if anything seems amiss. Lithium can be harmful in a variety of ways, not just to the kidneys. 2. Antiviral medications. Most viruses heal up on their own, but doctors prescribe antiviral medications for dangerous or long-term infectious disorders such as COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These medications can eliminate the flu and other viruses from your body. Oseltamivir, Tamiflu, and zanamivir, Relenza, are two commonly used antiviral medicines for influenza. Antivirals cannot cure chronic illnesses such as HIV, hepatitis, and herpes, but they can alleviate symptoms and reduce their severity. Antiviral medications have significant advantages in treating viral infections, but their potential to harm the kidneys should not be underestimated. This risk, whether from direct poisoning or crystal buildup, which can lead to kidney stones, is substantial. Careful supervision and personalized treatments are required, particularly for patients who already have kidney difficulties. Consider remdesivir, a medication approved for emergency usage in COVID-19 patients. Remdesivir contains SBECD, which is primarily eliminated from the body by the kidneys. In persons with kidney problems, SBECD can accumulate and induce kidney toxicity. Some clinical investigations have found variable decreases in renal function with remdesivir. Furthermore, data from global databases revealed a significant increase in incidence of acute kidney failure related with remdesivir compared to other COVID-19 medications. However, there hasn't been enough large-scale clinical evidence to determine whether remdesivir is safe or dangerous for persons with renal disorders. Therefore, further research is needed to bring clarity in this area. Aside from remdesivir, the use of more potent antiviral medications frequently results in drug-induced acute renal impairment. Some antiviral medications, such as cidofovir, adefovir, foscarnet, acyclovir, interferon, and tenofovir, can directly cause cell death in renal tubules by decreasing blood flow or raising toxins. This syndrome is known as acute tubular necrosis. Furthermore, the antiviral medicine atazanavir can promote inflammation in the interstitial tissue of the kidneys, affecting renal function. Also, acyclovir and indinavir, foscarnet can produce crystal accumulation in the kidneys, obstructing the kidney tubules. In contrast, some antiviral medicines, such as Veride and foscarnet, can help manage kidney damage, but they also increase the risk of renal failure. As a result, taking these medications under constant medical supervision is critical to protecting the kidneys. Furthermore, antiviral medicines should never be skipped or used inconsistently to ensure their safety. This approach can cause virus adaptability, making antivirals less effective. This is known as antiviral resistance. Also, antiviral medications are only available with a prescription, so avoid purchasing them online or from unapproved sources. 3. Antibiotics. Antibiotics are frequently administered, but they are not without risk. Does your doctor give you medicines for a sore throat, a skin infection, or another ailment? If so, it could be harmful to your kidneys. First, let's define antibiotics. Antibiotics, often known as antibacterials or antimicrobials, are a type of drug used to treat bacterial infections. They work by either killing or stopping germs from multiplying. Common antibiotic brand names include Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin. These medications may be used to treat strep throat, pneumonia, urinary tract infections, UTIs, or skin infections. Antibiotics can help treat certain bacterial illnesses. However, they cannot treat viral infections such as colds, flu, bronchitis, most coughs, and sore throats. So, when your doctor recommends antibiotics, you should proceed with extreme caution. If given incorrectly, you may develop adverse effects such as diarrhea, liver, and renal problems. Even when taken correctly, several antibiotics, including polymyxins, aminoglycosides, and vancomycin, can affect your kidneys. Simply put, your kidneys play an important function in eliminating antibiotics and other medications from your body. However, antibiotics such as polymyxins can disrupt kidney cell membranes, potentially leading to renal injury. Similarly, aminoglycosides, another type of antibiotic, can accumulate in kidney cells, causing cell death and injury to kidney tubules. The method by which each antibiotic produces kidney injury is not fully understood. However, it may entail inflammation and damage to kidney cells. For antibiotics to be effective and safe for kidney health, they must be used properly. Did you know that approximately 1/3 of antibiotics prescribed in the United States are inappropriate for the illnesses they treat? This is according to a CDC report and a research published in the Journal of the American Medical Association. Before you request an antibiotic or your doctor prescribes one, you should be aware of the problems they can cure. You can ask, "Is this necessary?" and most doctors would readily explain why it is. If antibiotics are absolutely required, take the recommended dosage and obey any dietary restrictions. Even if you feel better, never keep antibiotics for later use or give your prescribed antibiotics to someone else because prescriptions are specific to your health needs and condition. Are you enjoying our video thus far? If so, please give us some feedback by liking this, and we'll create more content like it. 4. Diuretics. Diuretics can help with problems such as fluid retention or edema, which are common in heart and renal failure, as well as liver cirrhosis. Some diuretics are accessible over the counter, however, prescription diuretics are often more potent. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They act by boosting urinary production. They're also good at excreting extra salt and water through urine, which can help with hypertension, high blood pressure, a major risk factor for kidney disease. Thus, diuretics are generally good for your kidneys. While diuretics are generally beneficial, they do carry hazards, particularly for kidney function. Unlike NSAIDs, they do not directly injure the kidneys or impair their filtering function. Instead, they work farther down the kidneys process, affecting the concentration and composition of urine. This raises the volume of urine or alters its electrolyte content. Excessive use or high doses of diuretics can cause dehydration, which is a risk factor for kidney injury. A hospital research examined 131 individuals who used diuretics and suffered acute renal damage between 1999 and 2010. Prior to taking diuretics, 96.2% of patients had at least one health condition, with chronic kidney disease, CKD, accounting for 55.0%. They discovered that patients who used diuretics had a greater incidence of renal illness and risk factors such as hypertension and diabetes. The larger the dosage, the greater the risk. Furthermore, diuretics alone were responsible for approximately 27.5% of acute kidney damage cases, whereas others were caused by a combination of diuretics and other medications. Always check your doctor before taking any new diuretic drugs. People with CKD who use diuretics should stay hydrated and have their electrolytes and renal function checked on a regular basis. Nowadays, there are more home testing choices than ever before. People can now monitor their kidney function from the comfort of their own homes. 5. ACE inhibitors. Angiotensin-converting enzyme, ACE, inhibitors are prescription medications used to treat high blood pressure and disorders affecting the heart, blood vessels, and kidneys. Common ACE inhibitors include lisinopril, Zestril, Prinaval, Ramipril, Altase, Enalapril, Vasotec, and benazepril, Lotensin. These medications act by inhibiting the enzyme that creates angiotensin II, which constricts blood vessels and raises blood pressure. By inhibiting this enzyme, ACE inhibitors assist relax blood arteries, lowering blood pressure and reducing stress on the heart. ACE inhibitors typically enhance blood flow to the kidneys, reducing the burden on these critical kidney-shaped organs. This increased blood flow can preserve the kidneys, particularly in the long run. Furthermore, ACE inhibitors may help reduce protein in urine, which is a typical concern in chronic renal disease. In fact, ACE inhibitors are frequently suggested for patients with renal problems. While these drugs have protective benefits, they are not without hazards. When they are combined with NSAIDs and diuretics, your risk of AKI increases. Also, if you don't drink enough water to meet your body's demands, using ACE inhibitors may increase your risk of AKI. If you're concerned about your risk of AKI while taking these medications, speak with your doctor about strategies to reduce it. Some people are concerned that ACE inhibitors may reduce your estimated glomerular filtration rate, eGFR. Typically, A higher EGFR indicates improved kidney function. However, ACE inhibitors lower EGFR by alleviating pressure on the kidneys and allowing the tiny filters, known as glomeruli, to relax. While this may induce a minor decrease in EGFR, it does not indicate renal disease. It merely signifies that the kidneys are relaxing. However, EGFR can occasionally decrease too low. This is especially dangerous for people with heart failure, chronic kidney disease, or blockages in both renal arteries. If this happens, your doctor may change your dosage or temporarily discontinue the medication to determine the cause. It should be noted that in rare circumstances, especially in individuals with heart failure or extreme dehydration, ACE inhibitors might cause acute renal failure. However, after the medicine is stopped, most people recover without long-term renal impairment, even if they require dialysis. Patients with heart failure, diabetes, or CKD benefit from ACE inhibitors because they reduce the burden on the kidneys and provide long-term renal protection. However, dosages should be carefully adjusted and kidney function monitored on a regular basis. So, before starting, tell your doctor if you have kidney, heart, thyroid, or breathing difficulties, Addison's illness, or Brugada syndrome. Additional advice for safe use. Do you think your medicine is hurting your kidney health? It is critical to seek medical care right away. Symptoms of kidney failure may not be visible at first, but as the condition develops, indicators such as decreased urine production, leg edema, shortness of breath, and extreme exhaustion become more noticeable. If left untreated, the effects can be deadly. Let's make sure you remember these symptoms so you know when to act. If you are using any of the medications mentioned in this video, you should have your kidney function checked on a regular basis using tests such as blood creatinine levels, glomerular filtration rate, GFR, and protein testing in urine. Proper hydration helps your kidneys remove sodium, urea, and toxins from your body, which can reduce the effects of nephrotoxic medicines. Be mindful of any potential interactions between your drugs that may affect your kidney health. Share all of your current drugs with any healthcare provider who prescribes a new drug. Yes, pharmaceuticals are necessary for treating a variety of medical diseases, but some treatments carry considerable hazards to kidney health and should be used with caution, particularly in those who already have renal disease or who are prone to kidney disease. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral medications, and lithium can all decrease kidney function through a variety of mechanisms, including direct toxicity, effects on renal blood flow, and electrolyte imbalances. It is critical for people with kidney illness to avoid or carefully monitor their usage of these drugs. Patients should collaborate with their healthcare professionals to choose medications that are low risk to their kidneys, change dosages as needed, and periodically monitor renal function. A healthy lifestyle can help you reduce your prescription use. To prevent your kidneys from injury, eat a well-balanced diet rich in lean protein, fruits and vegetables, and exercise regularly. And if you're serious about improving your kidney health and knowing how the body works, be sure to subscribe to us. Tap the bell symbol and enable all notifications to ensure you never miss a life-saving video. If you loved this video, we think you'll like the video on the screen. See you there. Stay educated and stay healthy.